at this. You guys are quieting down without me saying anything. Thank you very much. So what are we doing today?
The pelvic girdle.
And what else?
What?
The foot.
Today?
So being prepared and expecting what's going to be in class is really valuable because then you know what the hell's happening. And you're not like, huh? What? And by the way, when you go into a big lecture hall, if you sit up and way in the back on the right-hand side or the left-hand side, you know what that means to the professor? You're barely keeping track. You're like, huh? Whatever. I once had a kid in my lab. I was at Eastern Connecticut. His name was Clay. And he's come in at 8 o'clock lecture. He would come in Monday, Wednesday at about 5 after, and then on Friday morning, he would come in around 8:15. And the lecture was only till 10 to 9. And so one day in lab, I said to him, hey, can I talk to you for a second? I said, when you come into class, oh, and by the way, he also sits. So you see where Rochelle's sitting? Rochelle's like just sitting way in the back in the corner, and he just sort of put his head against the wall. I said to him, look, you're doing okay in the lab, and it seems like you're a smart kid, but you want my suggestion, my unsolicited opinion? He goes, yeah, what do you mean? I said, don't come in late, don't sit up in the way back corner, and don't put your head against the wall when you sit down. I said, look, if you can do this if you want, it doesn't matter to me. I said, if I were you, I would ask you to sit right here in these those first couple rows, and you're gonna be more likely to pay attention, you're gonna be more likely to listen, and you're also gonna make eye contact with me, and that's gonna be more energizing for you. Okay, it's only a 50-minute lecture. And he looked at me like, wait, you know that I come in late? I said, yeah, you come in late Monday and Wednesday about 10 after. On Fridays, you come in late about 20 after, or close to sometimes a half hour after the class started. Look, how do you know that? I said, I'm not an idiot. I see you walk in. You're not being like, and then I proceeded to say, well, there's this kid here and this is, I don't remember their names, right? But I was like, I know what they're doing. Right? Someone yesterday fell asleep in class. I know that. In this class. You're not hiding it from me just because I'm saying it. You're not you're not pulling one over on me anyway. So Cliff looked at me like I was like an amazing person, and I said, I'm not that. Every professor knows that. They just don't say anything. So the next week, Monday morning rolls around, and Monday morning, 8 o'clock was hard, right? He was there. I got there around 10 on. He was there right with me. I was like, awesome, all right. And then he sat down right in the middle, right in front of me. Rest of the semester, he ended up he went from barely passing the class to doing very, very well, maybe a B+, maybe an A-, I don't know. So in being awake, being active as much as you can, yes, I know you're sitting down, but being active, writing things down, making sure that you're paying attention, and anticipating what we're doing in the class is all ways that you can be more successful in a passive environment like this. Once again, making sure your phones are away so that they're not accessible. If they are out, put them face down, turn the notifications off, and unplug your headphones if you have any out there. And I don't see any right now, so that's good. So we're doing the pelvic girdle today. And the answer to the question, what else? We're going to review for the exam. The exam is not next Monday. Don't tell Joey. She wasn't here yesterday. So you can come in next Monday, all right? No? Okay. So the exam is not next Monday. The exam is next Tuesday because we don't have class on that. And then what we'll do on Wednesday, that'll be the end of Unit 2. On Wednesday, we're going to start in with Unit 3, and that's the muscular system, joints and articulations in the muscular system, and in particular the skeletal muscular system. We're going to work on that at the end of Unit 1. At the end of Unit 2, if you haven't submitted stuff from LT, I'm going to go back to those assignments if they're open, and I'm just closing them, and whatever, I'm going to finalize the Unit 1 grades. There's 4 or 5 assignments, So make sure that you check if there's any problems with those grades, especially for Unit 1. What I decided to do now is once I post the grades for any assignment, so I did some grades for the Unit 2 assignment, everything but the 2 summaries, which are due, I think, on Monday night, right? So all the other assignments are graded. They're reopened, so you don't. So once you get a grade in your LT, like just say you didn't get around to doing it and you got a 0, right? If you submit it late, you can get a 50%, whatever the total number is, provided that you do have the work, right? So if you do 100% of the work, then you get 50% of the grade. Okay, so that's encouraging you to keep up. So there's no need for you to ask me to open it, or to tell me that you forgot or something like that, because what I'm going to start doing is, and again, now this is my new learning because this is a new style. I'm trying to keep up with grading, and I'm trying to make sure that you guys know that you missed something to remind you with a 0. Once again, the LT assignments are in Bio 221, not in Bio 220. Right? And just pay attention to that. Sometimes people get mixed up. They say, wait a minute, where's my grades for this? And it's in the other LT. So today we're going to talk just about the pelvic girdle rather. Tomorrow on Friday, we're just talking about the pelvic girdle. So it looks like I know what I'm doing when I made these classes align, right? It really looks like I planned this ahead of time. And to be honest with you, I try to get them close. I don't get them this close very often. Where you have the pectoral girdle lecture, the pectoral girdle mini practical, and then the exam all in 3 successive days. Right? So that doesn't happen very often. But I did it for you guys, so the planets aligned.
I'm proud of you, mister.
Once again, you're what?
I'm proud of you.
Oh, thank you so much. That means so much. No.
Oh.
It really, nothing to be proud of. It's just the way the schedule worked out, right? So, once again, this chapter, right, is 1/3 of chapter 7. It's the final part. And as I'm talking about the bones, another thing you should be doing is pretending to put the bones behind your back, even if you don't physically put your arms behind your back. You should be closing your eyes and thinking about the bone, what the bone is shaped like. When I talk about the os coxae, or the femur, the patella, or the tibia, when I'm starting to talk about those, pay attention to that. The other thing to remember is that when I get to the foot, there's going to be more specific bones asked about the foot in tomorrow's mini practical than the hand. Okay, the hand had really small bones, and a lot of them. The foot has much bigger bones, and they're easier to identify. So the first part of this lecture is the same as the previous 2 parts to this. So there's the skeletal overview, the axial and the appendicular. After today, we're done with the appendicular, and we're finishing up the pelvic girdle. The green are what we're interested in. Yesterday we talked about the green top part, the pectoral girdle, and now we're doing this part right here, the pelvic girdle. Just a reminder, different shaped bones have different names here. You can categorize them differently. The terminology is also important. In one case, it's not on this list here. So in terms of the projections, a specific term that is a term that's specific to the femur is called a trochanter, and that's also another projection. Oh, it's right here. I missed that. So the trochanters, that's a term that is specific to the femur. There's several different fossa, and one particularly large foramen that is really instructive. That fossa, that slight depression can be very, very deep in one case, and we'll talk about that. So today we're talking about the pelvic girdle, and the pelvic girdle includes 3 major structures here. There's the right os coxae, the sacrum, and the left os coxae. So combined with that is the pelvic girdle. The pelvic girdle then is with the leg, the upper leg and the lower leg, and then distally the foot. And so when you're talking about the pelvic girdle and you're talking about the os coxae in particular, the point of articulation between the femur and the os coxae is at the acetabulum. And when you have that articulation, there's technically 4 bones articulated. There's 3 bones in the os coxae and 1 bone in the femur. The large hole that I mentioned a minute ago is called the obturator foramen, and that's another major structure. That the obturator foramen is always anterior on the os coxae. The acetabulum is always lateral on the os coxae. So now it becomes easy. You put that in your hand. You find the hole. Okay, so that's sort of anterior, and then you go a little bit posterior and lateral, and you find that big, deep depression. Okay, that has to be lateral. So then you can start thinking about putting it oriented on your body, and you're definitely going to be asked what side of the body is it from. So that's the thing that's the process you should be thinking about. On the right-hand side, you have the colors. The colors here, the green, and I always say it the same way. And it's funny because when I started, the first year I started lecturing about the anatomy class. So this is back in, I think it was fall of 2013. I was talking about this part of the class, and I said, so the os coxae comes in 3 bones, the ilium, ischium, and pubis, the ilium, ischium, and pubis, the ilium, ischium, and pubis. And I said, I started laughing at myself, and I said, the reason why I'm laughing is because many years before that, I started teaching my students to say it the same way, write it the same way, in this case 3 bones, and don't ever say it any way different, right? Because then the ilium, ischium, pubis, now you have the os coxae, right? So the green, there's the ilium, the ischium, and pubis, right here. Superior and lateral, inferior, posterior, antero, superior, or well, anterior and medial, right? So ilium, ischium, pubis. There's 2 points of articulation. There's an articulation right here, medially, that is an anterior, that's the pubic symphysis. And then there's another articulation right here, we talked about it yesterday. This is the sacroiliac articulation. There's the left-hand side and the right-hand side. Before I get into the real details of this whole thing, let's talk a little bit about the pelvis itself and the pelvic arch, or the pelvic girdle. So we have the sacroiliac joint right here. We've already talked about the sacrum itself, so that we have, this will be S1, inferiorly right here around the coccyx. And if you look and you follow your mind's eye right around here, this is the iliac crest. And then if you go anteriorly, there's a little bump there, that anterior superior iliac spine. It's a little point that sticks out, that projects anteriorly. And if you go like that, and if you ever wonder where your pelvis is, where your what is it? What?
Your ilium?
No. What the hell is the one that I want to say pancreas, and it's not the pancreas. What's the thing you can get it inflamed and you take it? Your appendix. Sorry, I drew a brain apart here. So if you ever wonder where your appendix is, find that on the right side, this anterior superior iliac spine. Find that on the right side. Go in a couple inches, go down an inch and a half, 2 inches, and that's pretty much where your appendix is. That's right about there. So that anterior superior iliac spine is very instructive there. So now if we're going anterior from there, I'm sorry, let's go medial. If we go medial, in this area right here, we're gonna have the iliac fossa. It's not labeled at that point, but I'll show you where that is. This major depression here is the acetabulum, and then this hole right here is the obturator foramen. We have 2 major processes, part of the pubis. There's one process right here, and that's called a ramus, and there's another process right here, that's another ramus. There's the ischium has a ramus, and then posterior, and it's not really that easy to see, the ischium also has a tuberosity. That large tuberosity is a really strong point of attachment for muscles that we'll talk about being hip flexors. So the fusion of these three bones, the ilium, the ischium, and pubis, results in the bones being covered over, but we're still going to classify them as three. We're talking about this being the os coxae, and that's the term that I'll use. There's several structures that are present in the ilium. And so here is a list of structures that are present in the ilium. The posterior superior iliac spine, the anterior superior iliac spine, those are, as the name would indicate, superiorly. The auricular surface and the sacroiliac joint are on this bone medially. The greater sciatic notch, where my pointer is, that's another major point of orientation for the os coxae. If you put your hand in this notch, you can fit 2 or 3 fingers in there. If you put your hand in that notch, then you know you're oriented in the posterior direction. And then the iliac fossa is this gentle depression as part of the hip, or the os coxae. I mentioned the ischium a minute ago. The ischium has a major tuberosity, that ischial tuberosity. The ischium is always infero-posterior located, so it's inferior and it's behind. And it has a major ramus, the ischioramus. And that ischioramus, which is inferior, that ischioramus then merges with or fuses with the inferior pubic ramus. That inferior pubic ramus goes to the pubic symphysis, and then it goes to the superior ramus of the pubis, or the superior pubic ramus. Together, those 3 rami form the obturator foramen. There's the pubic symphysis, where the 2 left and right pubic bones meet, where there's fibrocartilage there, and that fibrocartilage is permanent unless there's one thing that happened, one major event in someone's life.
And it's birth.
So it's not a big deal, right? Literally when you're giving birth, or, well, some of you, not me, when you're giving birth, right, if this is the pubic ramus, through hormones and other things, right, the articulation comes apart. And when that articulation comes apart, there's a little bit of pain. I've heard, not that much. It's not that big a deal.
Didn't they used to, like, wasn't the chainsaw invented for that, too?
To cut the pubic arch, those pubic symphysis?
Yes.
I don't know. That's the first time I've ever heard that.
The chainsaw was invented for childbirth.
What?
It was. I'm not.
So I'm not arguing, right? I'm surprised. I have no comment. I can say that if you use a chainsaw during childbirth, it probably won't be very...
Well, it was a handheld.
Oh, okay.
The cutting device was specifically designed to make removing the woman's pelvic bone easier and less time-consuming during childbirth.
Now who is we?
There we go.
The other thing...
How have you never heard that?
She's telling the truth.
I am!
So just because I don't know everything doesn't mean
You're supposed to know everything.
Oh, doctor, you know everything, doctor.
right? It's okay. So when getting back to this pubic symphysis here, when you're talking about the 2 pubic bones articulating, here the 2 pubic bones, when they articulate, they form the pubic arch. I'll do that to you, because Joe's doing that, right? But they form the pubic arch, and then as a result of these bones articulating, that is to say the sacrum and the left and right os coxae, they also form part of the pelvis itself. There's the false pelvis and the true pelvis, and that true pelvis has the pelvic inlet and the pelvic outlet. And then we'll talk about what those terms are.
What's the brim?
So this, if you look, here is on the left-hand side the male pelvis, and on the right-hand side is the female pelvis. Now, when I say the pelvis, right, I mean the combination of all these bones. When I say the os coxae, I mean these 3 bones. And since we're right here, what side of the body am I pointing at? Is this the left side of the or the right side? Are you sure? So if this is the right side, then this is anterior, this is posterior, this thing right here, what bone is this? So this bone is the ilium, and this is lateral.
It's the
This part right here is the pubic symphysis. That will be medial. So the only way that you can get all those things together is if it's the right side of the body. Right? If we were looking at if we had the same orientation and we were looking at this side, the left side in other words, we wouldn't be able to see the pubic symphysis and we would be able to see the acetabulum. Right? So if you see this smooth surface right here and no acetabulum, then it's one thing. And by the way, this big notch right here, that's always posterior. I mentioned that in a minute. So get back to this here. First of all, what's the difference between male and female? Our pelvises, males tend to be bigger, males tend to be bigger physically. The bones themselves tend to be bigger, but the arch itself is very narrow, less than 90 degrees. The arch on women is greater than 90 degrees. So the arches are different here. This red line right there, this red dotted line is called the pelvic rim. And that pelvic rim is where basically there's a division between the true pelvis and the false pelvis. The true pelvis and the false pelvis. The false pelvis is superior. And if you can see this part right here, this is the pelvic rim. There's the false pelvis, here's the true pelvis, and then this is called the pelvic outlet. Let's see. So Jelly, seriously, does that answer your question? What the pelvic rim? Okay. Let's see. What is this narrow tube right here? What's that for?
What is that for?
So it's this little canal. What's that little canal?
Nerves.
So that's part of the spinal cord, right? So. So here is a picture of the bone. Now, if this, you don't, this is probably a male, this narrow right here. No one has ever really, not really labeled it here. We have this major depression right here in the iliac fossa. Laterally is the acetabulum, medially is the pubic symphysis. Think what? Here are some of the major structures of the pelvises, whether it's male or female, and the distinctions between the two. And I will go on to the pictures here. So if you look at this, now this says hip bone, and this is something I should have changed. I don't know why the book doesn't use the term os coxae, but I do. So in a lecture question, or in the exam questions, it'll be the term os coxae. So first thing is you have to be able to tell me which is lateral and which is medial. So once again, is this a lateral or a medial view? So it says lateral right there, so that's lateral. If that's lateral right here, and it is, then which side of the body is this from? So are you looking at it from this side or from this side?
I think that's the right side, right? Because we see that acetabulum.
So you see the acetabulum, absolutely.
I thought you said, yeah, that's when it's
So that's always lateral, and that's what that says. Right, so absolutely, I'm not trying to trick you. So the green part is superior. This, hold on a second, this major indentation, that's called the greater sciatic notch, that's always posterior. So if you're looking at it from here, and you are looking at my lateral surface here, right, which direction will my sciatic notch be pointing? That way? And is that correct? No. You're looking at it that way, is that correct? Yes. Annalise, what's the question?
Is this the iliac crest, like when you feel like a bump, is that like the iliac crest?
So the crest itself is the top, and then there's the, here, I can't point to it. The crest itself is the top, and then anteriorly is the anterior superior iliac spine. So this part right here is the crest.
No, she's talking about like your hip bone, like how you can feel your hip bone, like towards the front kind of.
Yeah, so turn towards the front. If you're touching it towards the front, which is right underneath my belt, that's the spine, the iliac spine, the anterior superior iliac spine. Bless you.
Thank you.
There's another indentation called the anterior inferior iliac spine, both of which there's little bumps point anteriorly. One's superior, the other is inferior. They're all both part of the ilium. Right? Now, if you see this part right here, this is on the left side, this is a lateral view, and this is a medial view. If this is a medial view, and it is, then what articulates where my pointer is? The sacrum. Right? Now, so then, if this is a medial view, and it is, what articulates right there?
The other OS coccyx.
What bone, what part of the os coccyx, and which side articulates right there? Okay, so now listen to the question. And I'm not asking you what side of the body is this from, because this side and this side is the same. So this is the right side, so all we're doing here is,
So the left.
so this is the right side, and now you can't see the right side as well. Right? Why? Because the left side is in the way. So what articulates right there? The left pubic bone. Okay? So think of the questions. Now, my original question was what articulates in this surface, the auricular surface. We don't have a left or a right sacrum. Why not? Because it's right down the medial line of the body. You can see these drawings right here with the colors. So there's the ilium, the ischium, and the pubis. You can see the greater sciatic notch and the greater sciatic notch always pointing posteriorly. And then this is another view of this, right? You should still be able to tell me what bone is what in this, on this structure right here. Now, one thing I will tell you here, what is this thing right here in the lower left-hand corner? What is it? What's this whole structure called?
Acetabulum.
Acetabulum, right? That's okay, right? So this is the acetabulum. The one thing I will not ask you is, actually, what I should do is put the pointer right there and say, what bone am I pointing at? And then everyone will get it wrong, right? Because if you say one, then I could say, oh no, it's the other one, or it's the other one, right? So in other words, I'm not going to do that. I would say, what bone or bones would this structure make up or consist of? I won't say which bone is pointed right here. Okay. We good? Okay. Bigger pictures of it.
Wait, so that medial view is the left side?
So this medial view is the right side. So we're looking at it, so this is posterior, right? So that's posterior, and this is anterior. Right? So if this is posterior, and it is, then we're looking at this side. So it's this side, right? Well, right from this side. And then we go around like this, it's this side, and it's on the left side. Okay? Let me see here. I don't know. Let's see here. I have more pictures of these bones, right? The os coccyx. Here's a picture of here it's labeled better, the lateral os coccyx. And the medial os coccyx with the auricular surface or the articular surface. This term auricular or articular are the same thing. So don't get those mixed up.
Wait, what? Say it again.
So you see where my pointer is? It says auricular.
Yeah.
If it says articular surface, that's the articular surface and auricular surface are the same thing. In both cases, they articulate or the surface is for the articulation with the sacrum. All right. So now, if we're going back to the, whoopsie, let me go back here. If we're looking at the acetabulum here, that cup is part of an articulation that is infamous or.
That's where the joint is, though. Yeah, like when you know the words. Oh, we're saying like how you know the words, we just know like where it is on the bone automatically, like when you learn like fossa and foramen and all that stuff. Like it's easy to locate it, like let's say you don't know where it is and it says like something foramen, you look for a hole. That's what we're saying to you. Yeah.
Right, and that helps you, and that vocabulary is what we started in quiz 2. Right, so that's how important this is. Right, now, if you're worried about, if you're looking at this structure right here, the acetabulum, that big cup right there is for an articulation, and that's for the head of the femur. That articulation, we have 2 of those in our body. They're called ball and socket joints, and we'll talk about that next Wednesday.
Wait, okay, so we have to know, these behind our back too? Like, is that
So
what it's
for this week, everything that I've just talked about, yes, you have to know behind your back.
The pelvic girdle is what you do behind the back.
Yes. And so I like to joke around, but I'm not joking, okay? I'm really not around right now, okay?
like Latin.
So it's just like 2 weeks ago, but with all of this stuff, okay? Now, why am I doing this to you? John is like,
Because you
I'm gonna
hate
pay
us.
you, man, I'm gonna beat you. Why are you doing this to me, right? You need to know it for Tuesday.
Sadly.
Right? So basically, I'm tricking you into studying early. Why did I do the axial skeleton so early? Well, partly because that's the way the class runs, but I'm also tricking you into doing it early. The earlier you do it, the better, easier it is to digest, and hopefully the easier it is for you to remember. Yes?
So when you do mini practical, is it gonna be like the interior view? Is it gonna be like the whole thing or like just one optional?
Yes. So I have both.
Oh.
Right? So I have I have individual sacrum with coccyx. I have the 2 os coxae. I have an intact pelvic girdle. I have the skeleton. Right? The skeleton is going to be right in front of you. Right? It's going to, and if you want, you can turn the skeleton around and stuff. If you, right? So it's going to be there. Right? But yeah, you'll be okay. Is this hard? Yes. So get studying now, and that's why we're talking about this. There's a lot of stuff. The femur has a lot of stuff. The femur has a bunch of stuff that is superior or proximal, and that proximal part here includes the head and the neck. I'm not worried about the anatomical and surgical neck, so I just call neck. That neck is the narrowing of the head. There's the 2 major projections that are called the greater trochanter and the lesser trochanter. That greater trochanter is superior, and I'll show you a picture in a minute, is superior and lateral. That lesser trochanter is inferior and posterior. So again, which one is which? The greater trochanter is larger. What are those things used for? For points of attachment for muscles. Whether the muscles that start up here or muscles that start down here. I'm going to skip the patellar surface here. Staying on the posterior view, posterior aspect of the femur, and going distally, here we have a long line that runs up and down the posterior portion of the femur, and that's called the linea aspera. That linea aspera is a posterior portion of the diaphysis, and that is basically where muscles will also attach. Some muscles are shorter than others on the posterior hip, and then those are, and sometimes they start right there. Continuing posteriorly, we have both the epicondyle and condyles. So the epicondyles, you should be able to tell me where the medial or the lateral epicondyles are. In both cases, the epicondyle will be proximal to the condyle. The epicondyle means superior or away from or on top of the condyle in this case. And then there's the medial and the lateral. If it's the medial one, then it's in line with the head. If it's the lateral one, then you go down the head and you go on the other side. So these are the condyles here. Now, all of those things that I just mentioned are all things that you can see at the very least posteriorly. When you're talking about the condyles themselves, those are part of the knee now we're talking about. When you're talking about the posterior projector, there's a major indentation, and that's called the intercondylar fossa. And that intercondylar fossa is always pointing posteriorly. And then finally, the other thing that I skipped over here, and that's called the patellar surface. The patellar surface, as the name would indicate, is where the patella articulates, and that patella surface is not very prominent, right? So my suggestion for you is to find the intercondylar fossa, which is really, really obvious, right? And you find that, and then you go, if I say to you, find the patellar surface, find the intercondylar fossa, go to the other side, and say, okay, so it's gotta be there, and you'll be right. If you find this, and you go to the opposite side, you'll be correct. Trick here is you have to find that, okay? So, recognizing these structures where they are in relation on the bone, whether the anterior or posteriorly. One hint about the femur, there's a whole bunch of stuff posteriorly. Look at this picture right here on the left-hand side, these drawings. Which one is anterior? The left side or the right side? Which one is anterior?
The right side.
So which one's anterior? I didn't say which side of the body. So is this anterior?
Yes.
Okay, so good. So it says right there, I know that. Right? So if this is anterior and this is the patellar surface, and that's the structure that I just mentioned that is a little bit subtle. If you also look here, there's not a hell of a lot in the anterior portion of the femur, so let's go to the posterior portion of the femur. First of all, that intercondylar fossa is this major indentation. You put one or two fingers in there, and you can leave your finger in there, and you can feel that. That fossa then is on the opposite side of the patellar surface. Move to one side, you have the medial condyle, the other side is the lateral condyle. Where my pointer is the medial condyle, and that is in line with the head of the femur. So the head of the femur always has to go medially towards the acetabulum. And then there's the neck. Again, we're not worried about the surgical or anatomical neck. The greater trochanter is, as the name would indicate, is bigger, but it's also superior and lateral. The lesser trochanter is inferior and posterior. It's a little bit medial too, but particularly inferior and posterior. On our bones in the lab, the linea aspera is not nearly as obvious, but it is there. There's a little bit of a bump here, and in particular in our bones, when I say our bones, the plastic bones in the lab, the gluteal tuberosity isn't really present. And then finally here we have the epicondyles themselves. So not only do you have to know the condyle on this, so like in the humerus, there's the medial and lateral epicondyle. We didn't really talk about the condyles, names of the condyles, except we talked about the trochlea and the capitulum. Right? Those had specific names. Lateral condyle, epicondyle, lateral condyle, medial condyle, medial epicondyle. Again, the epicondyles are points of attachment for muscles. The condyles are points of articulation with other bones. Now, distally, what bone or bones are going to be articulating with the medial and the lateral condyle?
Well, no, it's tibia.
So now, first of all, what joint or articulation are we talking about right here? No, not the patellar surface. What joint or articulation? What's this? Before you came into this class, what would you call this? The knee. Right? So this is the knee joint. So now, in terms of the knee joint itself, we're talking about the femur, right? Anterior, the patella, and then what are the two distal bones? The tibia and the fibula. So we have 4 bones there. So don't say the femur here, because that's this. What bone or bones articulates right here? So we have the tibia, the fibula, and the patella. Is the patella at all in play here? No, because the patella is right here, so that's not. So then, the next question is, we have the tibia and the fibula, and if you look at here, I'm putting to the lateral condyle. is the fibula articulating with the femur and the lateral condyle?
No, it's
Oh,
fibula.
fibula.
I'm trying to trick you, and it worked. The tibia comes up and produces a big shelf.
Oh,
That
so
big shelf has two condyles. There's a medial condyle and a lateral condyle. Just the tibia, right? So those medial condyle and lateral condyle, and on distal from the lateral condyle, we have the fibula that comes down, and it supports the lateral condyle. So the fibula doesn't play a role in the knee. So I tricked you guys. So remember that. The tibia doesn't play a role in the knee. The fibula doesn't play a role in the knee. The tibia is the only one, the distal bone that's part of the knee. So the knee has three bones. There's the femur, the patella, and the tibia. What side of the body is this from? So if you're at all wondering, right, you don't have to yell it out if you don't want to, but if that's uncertain, right, that's a problem, right? That's something very easy for me to ask.
Is it because when you be like, when we get the side, right, you be like, are you sure?
So what is
You
it?
be like, are you sure?
So what is it then?
It's the right side. Of course.
Are you sure?
You see, you be like, are you make
You're
us
not
doubt-
answering.
You make us doubt ourselves.
Absolutely, I want to make you doubt right now. Because I'm not going to ask it during the exam. I absolutely want to make you doubt yourself right now. And then I want you to say, no, damn it, I am right. So is it the right side?
Yeah.
Absolutely. So then, if you're certain of this, then the next question, you're like, all right, well, I don't have to worry about that one. I got that right. All right, then you go on to something else. Right? So you want me to do that to you.
Yeah, but like, then you ask the next question, and then we have to doubt ourselves on the next question because we made us doubt ourselves on the first.
Mm-hmm.
Are you sure?
Uh-huh.
You certain? You're like, I'm sure.
Once again, more pictures of the femur with the labels right here. My suggestion is take screenshots of this, scribble out all of the terms right here. Take 2 screenshots, one copy, the original, and then the new one. And then write and label it again, again, and again. Yes?
Isn't all this on the skeletal documents as well?
Yep.
And
Yeah, so multiple places. There's plenty of places. There's also videos of this that I've created, right? And yeah. The patella is anterior and distal on the femur. This is a sesamoid bone, and it's the only sesamoid bone in our body that we'll talk about there. It's sort of weird because it has, it's basically a place where the tendon and the ligament then articulate there. So basically the patella is basically a pulley system for our anterior muscles and our what's called the tibial tuberosity. There's a little bump on your knee right there. That's called the tibial tuberosity. And so then that allows you to go like this and to extend your leg. And that leg extension is made much, much easier by the patella. There's the anterior surface and the posterior surface. The base is superior and the apex is inferior. And here is a inferior or inferior view of the right femur, right? So this is sort of a different view. So now if you look at these two, this picture right here, you can see is this an anterior view or a posterior view? So you can see down there, it's an anterior view. If this is anterior, is this the right side of the body or the left side of the body? This is the right side of the body. We have 2 major surfaces right here that have points of articulation with the femur. There's a little eminence right here. Can you see that intercondylar eminence? That little intercondylar eminence is a point of attachment for ligaments here. Have you ever heard of the ACL or PCL or MCL? Anterior cruciate ligament, posterior cruciate, I won't ask you about those until next time. But what those ligaments are these, they occur like an X here, and the inferior parts attached to the one side of the intercondylar eminence, the superior parts attached to the portion of the femur, and then the other one was like that as well. So it helps basically stabilize the knee joint. I said also that the knee joint itself only has 3 bones here. One is the tibia, there's the femur, and then the missing bone where my pointer, there's 2 missing bones, there's the patella and the femur right here. Just like I said yesterday with the radial ulnar joint, this point right here is the proximal tibiofibular joint. Down here is the distal tibiofibular joint. The fibula itself is lateral, always lateral. The fibula doesn't have a lot to it. It has 2 major structures. There's the head right there, and the head is associated with the proximal tibiofibular joint. And then this thing right here where my pointer is, called a malleolus or a hammer. Basically, this is the outside of your ankle, so this is called the lateral malleolus. The inside of your ankle is the medial malleolus.
You can touch that, right? You touch it. This one right here.
Yep. And if you're wondering, so you have a bump on the inside, you have a bump on the outside. That bump on the inside is bigger than the bump on the outside, right? So the tibia is bigger than the fibula, but that's what we're talking about here. Just distal from the patella. So now if you put your hand on your patella and you go down from your patella, have you ever been on the doctor's office and they do the tendon hammer and they go like this and they look at your reflexes? That particular type of reflex is another thing we'll talk about later on in the semester. But that tendon hammer hits the tendon that's distal from the patella. If you hit your patella, that would hurt. Right? If it hit distal from there, it would hit where my pointer is, called the tibial tuberosity. So basically the tendon hammer, if this is the patella and this is the tibial tuberosity, there's a little space between them. So he or she will find where that little space is and then smash it right there, and then your leg pulls out like that. That tibial tuberosity is another point. If any of you, when you were younger, were growing really, really fast, you might have gotten leg pains, and you may get really, really severe knee pains in this area. That's called, one example of that is called Auschwitz-Schlatter, and that's where the bones are growing faster than the muscles, and that's what growing pains is largely. The bones are growing faster than the muscles, and the muscles are literally straining to keep attached. And if the muscles are straining too much, right, ultimately they might get pulled off, and that's not good. But that point of attachment, that tibial tuberosity, is huge for the anterior thigh. And we'll talk about that later on in the semester. If you look at the terms that that are over here on the right-hand side, I've already talked about them, particularly the medial condyle and the lateral condyle. Those condyles are articulating with the femur. In between it is that intercondylar eminence. The medial malleolus and the lateral malleolus are distal, right there. Again, there's the proximal tibiofibular articulation, the distal tibiofibular articulation, and then there's a very, very strong interosseous membrane that isn't present in the previous drawing. That interosseous membrane is holding the 2 bones much more together, help hold them together. In terms of mobility, you're not as able, probably, I won't say exactly that you're probably not able to do this with your foot. I'm not saying that you can't, right? But you probably aren't able to do this, right? And part of that reason is that the interosseous membrane of the radius and the ulna, along with the structure of the radius, but the interosseous membrane of the radius and ulna is not as strong as the interosseous membrane between the tibia and the fibula. The anterior view and the posterior view, and you look at this right here, this section right here where you have the tibia, the interosseous membrane, and the fibula that goes all the way up and down the length of the bones, almost. And now let's talk about the foot. So the foot, the distal segments here, there's tarsals, metatarsals, and phalanges, just like there's carpals, metacarpals, and phalanges. Don't mix those up, right? There are 5 metatarsals, 5 carpals, 5 metacarpals. There's different number of tarsals. There's only 7 tarsals, and those tarsals are bigger. Those tarsals are, they can form the ankle bone, right here. Posterior one, the one that's major one, is called the calcaneus. So this one right here, that's the calcaneus, and that's the heel. That also has a point of attachment for the calcaneal tendon. That calcaneal tendon is also called the Achilles heel. You guys know the story about Achilles?
Mm-hmm.
So he's supposedly, what? So his mom, he was born and his mom dumped him in the river Styx, dumped him upside down, but was holding him by the Achilles tendon. And so because she dumped him in the water, he was later on he was a major warrior. He was impervious to arrows, except in the area where she didn't dunk him, and that was Achilles' heel. And so that was his sensitivity, so he got shot there, and he died. That's a story, I don't think that's true. All right, so, but this is the calcaneus here and the calcaneal tendon. And going anterior and superior right here, we have the talus. And then going in anterior from there. Now, we have the talus and calcaneus, and then there's another major bone called the navicular. So those are 3 major bones. And then there's the cuneiforms right here. There's the medial, intermediate, and lateral cuneiforms. So they're all in a row. Starting medially, there's one in the middle, and then the one more laterally. There's medial, intermediate, lateral cuneiforms right here. What did I? What's not on the list? 1, 2, 3. I don't know. Then the tarsals, the metatarsals there, the one thing about the metatarsals, they're numbered differently. Right? They're 1 through 5, but the hand metatarsals, 1 is lateral, and 5 is medial, and in the toe, in the foot, 1 is medial, 5 is lateral. And still, this is my favorite one, right?
Why did they do that? Why did they flip it?
So now I know you guys don't speak Spanish, but no sé nada means I don't know.
Damn.
I don't know nothing.
I mean, if it was like
I don't
this,
know
it'd
nothing.
be like the same
But
kind of
honestly,
exercise, so they just flipped
so
it because
the one thing about it is that the thumb and the big toe, or the hallux, right? The pollex and the hallux have a lot of in common. They have 2 articulations or 2 bones right here. There's a proximal and distal phalange there.
Yeah.
The same with the hallux, the proximal and distal phalange. So that makes sense that they're one. Why is, really the question is, why isn't this anatomical position? And the answer is, I don't know. So that means no say nada means, I don't know. In case you guys were wondering.
Oh.
Thank you.
Because they say, I know much more Spanish than you guys do.
Thank
wow.
Okay? The hallux is the big toe or the great toe. Oh, this list right here is missing the cuboid bone. I don't know why I didn't put the cuboid bone in.
Cuboid?
So, because it says there's 7 tarsal bones, and you need to know the cuboid. I'll fix that.
Yeah, that's 5.
Well, it's on the other one, like the other image on the left. But see, it's like over there.
No, the cuboid bone is on the left, but it's not on this list on the right. Now, if you look at the superior view of the foot, first of all, what side of the body is this from?
Right.
How do you know? Are you sure?
Yeah.
Yes.
Yes. Can you stop doing it?
No. And it bugs the hell out of most students, and that's why I do it. First of all, the answer is right in front of you, okay?
Yeah.
So then, if this is the right foot, and it is, no question, where in relation to the foot is my finger? Oh, wait a minute, my finger.
That's lateral.
That's lateral.
Distal.
Well, the distal one there.
So, the whole structure is distal, right?
Anterior.
Anterior. How about my red pointer?
Medial.
Medial. So don't get confused with it. Sometimes people get confused with that. The hallux here, and then the other phalanxes have 3 joints. Metatarsals here are 1, 2, 3, 4, and 5, medial to lateral. And now let's look at the tarsals. Okay, we can identify all the tarsals from this view. And so this is something that both on the exam and in the mini practical, I could ask you. I probably wouldn't ask you unless if you really nail this practical tomorrow or Friday, then I might go there, right? But I probably would. For some people who aren't listening to their doctors, their physicians, I might go there just because I'm still mad at her, but I won't tell you who it is. Beginning posteriorly, the major structure right here is the calcaneus. Now moving anteriorly, there's the talus, and the talus has a large articulation, and that's called the trochlea. What articulates right there where my pointer is?
The
Tibia.
So now, let me be more specific. What bone articulates right here where my pointer is? There's only one answer.
the tip. Fibula.
You see that face too.
So I'm listening. Wait a minute, I'm trying to listen. I'm hearing some mumble. And then the next question is, what part of the bone is going to articulate?
Medial malleolus.
So what bone?
From the tibia.
The tibia, and then what part of the tibia? The medial malleolus. Okay? My original question was what bone or bones articulates right here, and I wanted to be more specific because that was really too general. What bone articulates right here that is not part of the foot?
Fibula.
Fibula, and what part of the fibula? The lateral malleolus. So if you've ever sprained your ankle, someone right in front of me, who shall remain nameless, sprained her ankle recently. There's I don't know.
Not just my ankle, my
What?
foot and my ankle.
Well, I don't know exactly, but there's a good chance that the lateral portion of the ankle was the one that was injured.
Mine was
Other
floppy
foot.
like this.
So now, we're going posterior to anterior here, so we're starting with the calcaneus and the talus, and now we're going anterior here. Anterior to the talus and medial is the navicular. Anterior to the talus and lateral is the cuboid. So there's 4 bones right there. 4. I put 4. Right? And then going from medial to lateral are the cuneiform bones. There's the medial, the intermediate, and lateral cuneiforms. Okay? The cuboid bone is lateral. The navicular is medial. The medial cuneiform is medial. Okay? So you should definitely be able to identify these 7 bones from a diagram. You should also be able to tell me if it's in front of you. You should be able to say, okay, there's this, and that. Okay? And then the metatarsals and tarsals are pretty straightforward. I mean, the metatarsals and phalanges. All right. So.
Are you sure? Are you sure, Mr.?
Hold on a second. My wife sent me a text.
You didn't say good morning to her?
I already did. She said, good morning. Hope you have a great day too. Love you.
Oh, cute.
So we're also getting work done in our kitchen, and it's a mess right now. And she works from home, and so she's very stressed out. So
That was me.
I am done lecturing. What I would like to do is go get a cup of coffee. That I had today. And then I want to spend, so at 10 o'clock, let's do a review. Okay? This won't be a very long review.
I got a call. For half people, I got a call.
Okay?
For half people, I got a call.
Okay.